very hard-won gains. The place that we are in now, we are only here because of hard work by the medical team, by sacrifices by the business community, by sacrifices by individuals, places of worship. And I just want to remind the country that 3,787 people have in fact succumbed to the disease. And many, not many, some are still succumbing, albeit in small numbers. And these are mainly the elderly and the unvaccinated. So there are some lessons there for us. The issue facing us now is how do we conduct ourselves in the upcoming days and weeks so as not to lose and regress and go backwards. I think the strong recommendation that we can give this morning is one of personal and organizational and family responsibility based on your risk assessment, your tolerance for possibly acquiring COVID, getting COVID, taking it home to your unvaxxed elderly who are still succumbing to the disease, albeit in small numbers. I would like to contextualize this with one simple statistic, a 1-in-2 ratio. Remember that 50% of our population is vaccinated. So in any setting that you are in, whether it's a workplace, whether it's a social setting, a wedding, a funeral, a party, especially if someone is close to you without a mask and you don't know that person, remember that that person is a danger to yourself. The person standing next to you, if you're in a crowd of 100 people, based on the 1-in-2 ratio, 50 of those people are unvaccinated and pose a threat to you. And then you could take this virus home, infect your elderly, infect anybody who is unvaccinated, infect your community, shut down your workplace, your department. And we are getting some reports that certain organizations are reporting localized outbreaks in some work settings. So that 1-to-2 ratio is important because only 50% of the population is fully vaccinated. Whilst measures have been lifted, we must remember, and this is crucial for us to remember as a country, that the virus is still here. There are some countries, if you pay attention to the international news, that are seeing some record numbers. So I want to throw out a catchphrase for us to use as our health watchwords for the next couple of weeks or months, and especially this Easter weekend, where people will be gathering, but we ask people that the catchphrase we want to use is that of heightened vigilance and personal risk assessment. Heightened vigilance and personal risk assessment. Too many businesses have suffered through lockdowns. We don't want to go back there, and hopefully we'll never go back there. Too many people have died. So with the Easter weekend coming up, we want to ask people that this is a time to be aware, a time to be careful, to protect yourself. Protect your elderly at home who are still succumbing. Protect your workplaces, and also to protect our hospital system. Because we don't want the post-Easter period to be one where the hospitals start to report higher levels of occupancy, whether at ward level, ICU level, or HDU level. I want to leave you with one key factor again, which Dr. Hines alluded to. We cannot help but notice that County Victoria has always been that county which has had a abnormally high number of cases nationally. Victoria is now accounting for over 3,000 or 50% of the 6,001 active cases, with County Caroni followed by 16%. So those two counties, Victoria and Caroni, are accounting for close to 66 to 70% of the active cases. That is a worrying statistic. So everything I have said before, from protecting the hard-won gains, to heightened vigilance, to personal risk assessment, to protecting your workplace, businesses, it applies to all of us. But I think we really need to focus and shine a light on County Victoria and County Caroni to assist us by modifying how we act and conduct ourselves post the lifting of restrictions. So in closing, Al, I just want to close by saying that we have come too far to turn back now, but we could avoid turning back by the population adopting the simple catchphrase I want, that I have thrown out this morning, and that is heightened vigilance and personal risk assessment in how we conduct ourselves. Thank you very much, Al.
Thank you very much, Minister. Up next, we have our question and answer segment, and we want to ask the media representatives to state their name and the name of the media house before posing their questions. We will take 2 questions maximum per media house in the first instance, after which we will field additional questions from the media representatives once time permits. During this segment, we will also facilitate questions submitted by the MAT, Media Association of Trinidad and Tobago, on behalf of their members. We will take our first question from Guardian Media Limited. Good morning.
Hi, morning. Excuse me. Hi, morning, everyone. Rashad Khan here from Guardian Media Limited. Okay, so my first question, well, both questions actually are for the Minister of Health. Minister, firstly, thank you for the update on the pediatric Pfizer doses. But I noticed that when you were speaking about the delivery date or date of arrival, it seemed to be in relation to the indemnity agreement. Do we have an estimated time for the one from Spain? And my second question is, based on what you would have said there just now in wrapping up your speech, this warning that's coming for going into the Easter period, is this coming from a place where we're remembering what happened last year, and is it something that could be likely to happen again? Thank you.
Thank you. Thank you very much. So everything I said about the vaccine procurement for Spain is about that pediatric acquisition from Spain. The indemnity agreement, the draft donation proposal, everything had to do with that donation from Spain. So I was talking about one particular vaccine. Yeah. On the second issue, as the pandemic rate, well, I wouldn't use the word rages, as the pandemic continues around the world, I think when I said that pay attention to other countries that are still seeing record numbers, the virus, wherever you live in the world, is not in our rearview mirror. You may have seen that in one country, airlines and flights couldn't take off because flight crews came down with the virus. So as we are in the current situation and moving forward, we must still learn from the experiences of others that may not be in such a good place that we are in. And my advice this morning is based on the fact that only 50% of our population is vaccinated, that people are still dying, our elderly, even though the numbers are small, it is still a person, it is still flesh and blood, it is still somebody's aunt, it is still somebody's RG, poor grandmother, whatever. It is still somebody's family, and it is still a family in mourning. So all the advice that we are giving this morning is for the present, moving forward, and learning from the past. Thank you very much, Rashad.
Thank you very much, Minister. And we go straight across to TV6 for your two questions. Good morning.
Hi, good morning to the entire panel. Alicia Boucher from TV6 here. My first question, I'm not sure who'd want to take this, but the CMO mentioned that 10% of the population, I believe he said 10% of the population is boosted. In light of what we're seeing in terms of in terms of those numbers going back up, is that normal in terms of the percentage? Is that 10% normal based on the timeline of the initial vaccination as to when people would have had their first and second doses? Or are we seeing some sort of a booster hesitancy? So that's my first question. Second question, Minister, I know recently a director of NCDs was appointed, and I wanted to find out if we have a preliminary plan as to how TNT would be going to start dealing with the NCD epidemic. Thank you.
Hi, thanks very much for the question. So just building on the 10%. So the 10% is of the total population. The boosters is 140,000 persons thereabout, and that is, of course, when we talk about the people that would have had vaccines, we're looking at about 700,000. So a proportion of that, let us say just under 20% possibly, of the people that would have had their primary series completed. So I would say somewhat yes to that question in terms of the people being hesitant to have their booster, because we are, in terms of time, we are well within the time when we should have had a larger number of people having their booster. When we see what is happening by way of Omicron and its sublineages in other parts of the world, really the data suggests to us that we should be boosted as quickly as we can for those who have been vaccinated, and for those who have not, to have your vaccination series as early as you can, as the main public health measure for now to actually prevent serious infection and death. So looking at our particular situation in terms of the variants that we have, usually I get a weekly report from UE. Over the last week or so, we would have had 129 samples submitted to the university. Some of them would not have met the criteria. 118 of those would have come back as Omicron. One case as Delta, which is, although it is one, it is concerning that we still have Delta circulating in the country. So that is a concern because of the severity of Delta in terms of it, in the way it causes severe disease and death. So it is still here, it hasn't gone away. In terms of the Omicron, further breaking it down into BA1 and BA2, what we see in circulation is BA1 majority, but there's a significant amount of BA2, which is the sublineage that is causing a lot of issues in other parts of the world. We are now, based on last week's report, it accounted for 39% of the samples that were Omicron are BA2. So it is going up in terms of the percentage of Omicron, remembering that BA1 and BA2 are sublineages of Omicron. Is not a new variant of concern, but it is the one to keep an eye on in terms of causing severe disease and surges in other parts of the world. So I hope that answers the question.
Thank you very much. I just want to, whilst the CMO was speaking, I was actually crunching numbers. So Alicia, thanks for asking that question. I think we need to contextualize how many people are boosted, not as a percentage of the population, because you are right, 148,000 people represents 10% of the population. But remember, to be boosted, you need to be fully vaccinated. So the question is, what is the boostable population? So let's work it out. I did that while CMO was speaking. So 710,340 people have been fully vaccinated. From that, we have to minus 55,423 CMO because that's the 12 to 18, because they are not boostable. So that gives you a boostable cohort of 654,917. 148,346 of that 654,000 has been boosted, which means 22.6% of the boostable population who are eligible for boosting, they have in fact been boosted. So I think the more accurate figure is to put it as a percentage of the boostable population, which is 654,917 when you take out the 12 to 18 cohort. Right. Your second question, yes. So the NCD consultant via the Inter-American Development Bank, because you know our NCD program, I've said this many times in the past, is being funded by a loan through the IDB. So the NCD consultant came on board at the beginning of March. They are doing their preliminary works. We had a kickoff meeting about 2 weeks ago, and coincidentally, after this press conference today at 2 o'clock, I have a more detailed meeting with the NCD team to finalize a work plan going forward. We are tackling several things post-COVID, which had to be sidetracked because of COVID. One, and I'll see this now, that we need to boost our response to mental health, which is what we are doing. We also need to boost our response to blood donation and blood collection and our NCD program. So today I have a meeting at 2 o'clock with the team leads and their support people on all three of these issues. Thank you very much.
Thank you very much, Minister. And with that, we go back to Guardian Media Limited for a follow-up question.
Thank you again, Al. I don't know if the CMO will be able to answer this, but we have a report coming into the newsroom that there might be an outbreak of tuberculosis in Trinidad with 5 cases currently warded at Cora Hospital. I don't know if we have any information on this.
Right. So we, I mean, in terms of you said an outbreak with what, 5 cases? Richard, you hearing me?
Yeah, I'm hearing you.
Yeah. So just repeat.
It's about 5.
Yeah. So tuberculosis is an endemic disease to Trinidad and Tobago. We have tuberculosis all the time. Having 5 cases is not considered an epidemic to start with. But in terms, it's probably you're speaking about a number of cases in one particular locality. So what I'll do is I'll liaise with the medical director for thoracic after the meeting. And if I get any information related to it, we'll relay that through Mr. Alexander back to you.
Thank you very much, CMO. And we go across to Express for your 2 questions. Good morning. Good morning.
Good morning. Kim Bodram from the Express.
Yes.
Maybe the CMO could respond to my first question, which is going back to the counties of Victoria and Caroni and their high contributions to the infection rate. And obviously infections are caused by people not adhering to some of the health regulations. But is there anything about the activities, the business, the recreation in the area that is contributing to the opportunity for infection where people may not be also adhering to the guidelines that the ministry or the county health officers, for instance, would have noted? Also, Minister, this is something you would have visited many, many times, but schools are reopening soon. And just to ask you again about your comfort level with the vaccination rates among the children who would have been relevant for vaccination. Thank you.
Okay, so I mean, throughout the pandemic, we have provided updates in terms of the active cases throughout the 2 years. So what we have seen, generally speaking, I think, in most instances, the counties that were in front in terms of active cases was Victoria and County Caroni. They are highly dense population. When you deal with diseases such as this, you find the spread is related to the way people move and the way the housing is spread amongst the county, amongst other things. So it is really multifactorial, and it's difficult to say what attributes the higher numbers at this point in time. And I haven't gotten any indication from the respective CMOHs as to something different going on in those areas. Again, it has been the counties that have shown the highest rates throughout. Victoria, County Caroni, at times St. George East has gone up a bit. We saw it in St. Patrick later on last year as well. But again, Victoria and Caroni continue to be the ones that we're keeping a close eye on.
Yeah, thanks, Kim. So thank you for asking the question about schools. Again, it's a very important question that you need to ask over and over. Because the health and safety of our children is paramount, especially their mental health and their socializing health. We have stated from the beginning that UNICEF many months ago did an excellent paper on how countries should treat with children attending school during the pandemic. And I think the UNICEF document is very instructive that the continuing absence from school of children could have very, very long-term, non-medical, psychological effects on children, physical effects. They're not playing, they're not socializing. So I think countries around the world, including us, took a decision to reopen schools cautiously. We noted that when schools were opened, especially for forms 4, 5, and 6, and we started to vaccinate that cohort. Of that cohort, Kim, the 12 to 18 cohort, 61%, or I have the exact figure here, 55,423 are fully vaxxed, meaning they have had 2 doses of their Pfizer vaccine. So that's not a bad place to be. It's higher than the national average of 50%. And once secondary schools went back out, we noted there was no serious spike in cases, and we are taking a very cautious approach now with other children and other age groups. Keeping children home too long, I mean, some of them have been out of school for 2 years. All sorts of long-term effects on their general well-being, not only health, social well-being, psychological well-being. All these factors have to be taken into account, and we at Health understand that, and we fully support the decision made by the Ministry of Education based on a risk and reward situation that the rewards significantly outweigh the risk. So thank you, Kim, for raising the question. Once again, it's a very, very important conversation to have.
Thank you, Minister. And we do have a follow-up question from TV6. We'll take that question now.
Hi, yes, thanks again. Let me just stay on education. Minister, based on the direction that education is going in terms of the full reopening, I just wanted to find out if the UTT Val St. Teachers Training College has been decommissioned for COVID-19 use. I would note that the CMO said that right now we don't have anyone in step-down facilities. So I just wanted to get that information.
Sure, thanks. So what we are doing as we decommission facilities, we are always keeping 1 or 2 facilities in reserve. So we have already decommissioned the Tacarigua Racket Center. I think that should have been handed over already, if not, anyhow, it will be handed over very soon. We have decommissioned the step down at Debe, and as I have said a couple times before, out of an abundance of caution, we will be maintaining the UTT campus at Valsain there in the short to medium term, just in case we need a step down facility. That will be the sort of national step down facility. Hopefully, post-Easter, we come out of it unscathed, and then we could decommission it fully. But we always have to have in reserve some capacity to deal with unforeseen circumstances and unforeseen spikes. We must always be prepared. And the same watchwords I put out to the population, heightened vigilance, is something that we are doing. We are always vigilant. And whilst we have 2 years plus experience dealing with COVID, I don't think any country or myself could say we are expert, because the virus could mutate again. We don't know. So we always have to have in the back of our minds contingency planning, and we always are very, very vigilant. So thank you, Alicia, for asking that.
Thank you, Minister. I see that Guardian Media has a follow-up question. You ready for you?
Thanks, Al. I'm making up for the days that I wasn't here.
I see that.
Where were you?
Boy, not relaxing on a beach somewhere, unfortunately. Okay, so my question now is to Minister. Minister, we're at a point now where we arguably have some of the lowest cases we've seen in a long while. Yet the COVID-19 tests are still taking at least 5 days to return results to patients. And I'm speaking from experience. I myself am waiting on results right now, right? So now that we're making that move towards living with the virus, is anything being done, or can anything be done to bring down that time frame?
So I think it's probably, when we have set time frames for testing, we have always said 3 to 5 days. So hopefully you're on the outside side of the timeline, personally. But generally speaking, we try to keep to the 3 to 5 days in terms of our PCR turnaround. What has helped a lot is that we have been using gene expert machines. We now have those machines in all RHAs, so they can turn around individual tests in just a few minutes. So sometimes while you wait, you get your test results on site. We actually have 10,000 additional cartridges which came into the country on Sunday, just to ensure that we have enough cartridges to turn around those tests very quickly. We have other machines as well that take a little bit longer, but we hope to try to keep to our time frame of 3 to 5 days as best as we can.
Thank you very much, CMO. And we'll go across to azpnews.com for your 2 questions. Good day.
Hi, good morning. Swan Wire from ACP News. Minister, I'm not sure if you might be able to answer, but I'm still going to ask with regards to cost and COVID costing. Might you have a breakdown of the additional cost, COVID related to outfit schools with COVID-19 measures like sanitization and so on? And given that there's a rising cost of almost everything, including book lists, which now includes personal hand sanitizers, mask wearing, and so on, do you think that government could possibly step in to assist some schools in the provision of those, especially where the school population may not be as privileged as others? Thank you.
Thank you, Suan. So, Suan, as we have always said, anything to do with schools and education from that perspective should be posed to the Minister of Education. I will have no information on the cost it costs to sanitize a school or to maintain a school. That is really for the Minister of Education to speak about, and any other matters pertaining to education should be posed to the relevant authority.
Thank you, Minister. And we'll address some of the mad questions at this time. What are your thoughts on business owners choosing to keep their business as a safe zone? Is it legal?
Okay, so that goes back to my opening statements when I spoke about personal and organizational responsibility. So what that question revolves around is how we view organizational responsibility. Any business place can determine who comes in to their businesses. That is perfectly legal based on whatever criteria that they set. Some businesses have signs up: no sleeveless, no slippers, no barefoot. Those are their rules. And any business is free to determine who comes in to their business place. Right?
Clear. Thank you very much, Minister. And we will be able to take another question from TV6. Alicia. Ms. Boucher?
Yes, thank you. I'm here. I was just waiting to unmute.
Right.
Okay, so I do have a question for Dr. Mohammed. Dr. Mohammed, at this time, do we have statistics to say whether we have had any deaths due to complications from long COVID? And based on what you've seen, what is the time span taken to recover from long COVID at the lowest end and at the highest end?
Good question.
So thank you for your question. With regards to statistics and deaths due to long COVID, I'm not aware that nationally we have those statistics. Your question referred to complications due to long COVID. If you're referring to complications post-COVID, such as, some patients may develop interstitial lung disease, some patients may develop heart disease, some may have had strokes due to COVID, then certainly there may have been deaths due to complications post-COVID. But when we're speaking about long COVID and deaths due to long COVID, I'm not aware that there are any current statistics representative of that cohort of patients. With regards to the time span, It's really variable. Different patients recover with different time spans, and usually we tell patients that recovery generally happens within the first 3 months. However, we are seeing patients past 3 months for several months after that are still recovering from long COVID. So to address your question specifically, the shortest time span, remember, symptoms have to occur past 28 days for it to be called long COVID in the first place. And in general, those symptoms should recover within 3 months. But we are seeing patients outside of that are falling beyond the 3 months, still having ongoing breathlessness and fatigue, which are the two most common symptoms that patients are reporting to us.
Thank you very much, Dr. Mohammed. And we want to thank the media for your engaging questions. And I hand you back over to the Honorable Minister.
Thank you very much, Al. Ladies and gentlemen of the media, thank you very much once again for being with us at these now weekly press conferences. The questions this morning were very erudite and very searching. So I just want to thank you for continuing to keep the messaging going. Before we close off today, I would just like to recap the main point of what was said about heightened vigilance and personal risk assessment. I cannot stress that enough as we move into a period where some festivity will take place. It's the most important period in the Christian calendar, but as a country, Easter is well known for a lot of socializing, getting together. If you remember that only 1 in 2 people are fully vaccinated, that is the key statistic I want people to understand as you make those decisions this weekend and in the weeks ahead as to how you socialize, how you gather, especially if somebody is around you without a mask in any setting, whether it's a work setting, and especially a social setting. If you don't know that person, you don't know the person, and is around you with a mask, speaking loudly over music, you are eating and drinking and liming, put the chairs apart, separate, just do the common sense things to not only save yourself, but your elderly parents, and to save the country. Too many businesses have suffered around the world and in Trinidad and Tobago, and we really want a nice, full economic and social recovery. So let's all do our bit, all do our part as individuals, as families, as lineman partners, to make sure that the hard-fought gains we have made, we don't lose them. Thank you all very much for tuning in this morning. God bless you, and may you have a safe and enjoyable and hopefully a quiet Easter. Thank you.
Thank you very much, Minister. And that's all for now. I don't think anything could be said after that. Thank you very much for your time. Goodbye for now.
My name is Winston Murray, husband, a father, and I'm also a COVID-19 survivor. On the 8th of August 2021, I contracted COVID-19. One of the scariest parts in the hospital to me was seeing people that I would have conversed with passing away. I was one of the persons that was against taking the vaccine. There's a help page. Go up on the help page, ask a doctor, visit a doctor, ask a professional about COVID-19. Don't delay. Get vaccinated today.
In crisis situations, children can perceive anxiety, which can cause them to feel stressed. Depending on their age, their response may vary. Some may become overly attached, while others may withdraw. Some may become anxious, angry, or agitated, and others may even start wetting the bed. Here are 5 tips to help manage stress in children. Play. Encourage children to play and suggest activities to help them relax. Bond. Try to keep children close to their parents, caregivers, or family members. If separation is necessary due to hospitalization, quarantine, or isolation, try to ensure regular contact via telephone or any other available means. Routine. Establish a daily routine or schedule and stick to it as much as possible, especially in the house. Create a routine in which they can participate in household activities, but also provide enough time to play and rest. Talk to them. Explain what's happening and provide clear information on how to reduce the risk of being infected by the disease. Be clear. Use words and phrases that are easily understood and age-appropriate. Calmly explain what could happen if your child or a family member begins feeling unwell. Let them know they may require medical attention or even hospitalization to make sure they recover. Remember,